Good morning, good afternoon, and good evening, everyone. I welcome you all to the 23rd day of uninterrupted IFPH English webinar session. Let's start our session with the silent prayer. Thank you all. Before starting the session, there is an announcement. Uninterrupted daily webinar session of International Forum for Promoting Homeopathy has successfully reached the 5th year. We are happy to welcome you all to the 5th year anniversary celebration of IFPH, which is going to be held on 28 September at Hotel Taj Vivenda, Kochi, Kerala. Join the celebration with us and give all your supports for promoting homeopathy. Let's start our today's session. Our today's guest is Dr. Asha B. Varghese, Chief Physician of Ambadi Homeo Clinic, President of Indian Homeopathic Medical Association, Bangalore, and she is having 20 years of experience. Now, she is here to present on the topic of management of liver problems with homeopathy. I welcome you, Dr. Asha B. Varghese. You can start your session, Doctor.
Thank you, Dr. Shweta. I'm no more in the position right now. I was 2 years back. Anyway, thank you so much. I'll just share my screen. Thank you to all the elders for giving me such an opportunity. Today's my topic is liver complaints and homeopathy. Is it seen? Sir,
Yes.
can it be seen?
Yes, Doctor.
Yeah, 1 second. I'll just make it full screen. The first case we will be looking at is liver fibrosis. So these are the 4 pictures of a liver. First one is a healthy liver, second one is a fatty liver, third one is liver fibrosis, and eventually leading to liver cirrhosis. So here I've taken up 2 cases, one of a skin-related liver issue, and one is a liver fibrosis F3 stage. So first I'll explain to you what is a liver fibrosis, then eventually we'll look into the next case. Fatty, first, before liver cirrhosis, we will look at what is fatty liver, FLD, which is very common nowadays. Fatty liver disease, it's a condition where normal liver tissue is replaced by more than 5 to 6% of fat. In FLD, the accumulation of fat can cause inflammation, cell death, and scarring, a condition called steatohepatitis. So here there is accumulation of fat. Everybody knows this part of it. Now look at the second part is what we are looking at now, the liver fibrosis. Left untreated, steatohepatitis can lead to liver fibrosis, which causes diminished blood flow throughout the liver and a buildup of scar tissues. Without treatment, liver fibrosis may lead to cirrhosis, liver failure, and even liver cancer. When repetitive damage or long-lasting inflammation occurs, collagen and other proteins build up between the liver cells, causing scar tissue. So this is a formation of scar tissue. Collagen or proteins build up and the scar tissue is formed. Scar tissue can block or limit the blood flow within the liver, starving and killing the healthy liver cells, causing more scar tissue to form. So the scar tissue keeps on increasing until the whole liver is fibrosed. Unlike healthy liver cells, scar tissues cannot function or repair itself. Because it's a scar tissue, we know that scar tissue does not have the capacity to self-heal. As fibrosis advances, it can impact the liver's ability to function, limits its ability. Hello? Okay. Limit its ability, repair itself, and restrict the blood flow. Over time, the scar in the liver will continue to build and replace healthy tissue. So eventually, all the healthy tissues will be converted into the scar tissues. Gradually, the scars snake out further, covering more of the healthy liver and grow together or bridge, creating a septa or band of scar tissues. Fibrosis also restricts blood flow, and when doctors want to determine how severe the scarring is, they examine the impact on the portal blood flow. That is, the portal vein brings all the blood from the intestines to the liver to be processed. So this is nothing but we are explaining how the scar tissue forms and eventually there is no proper blood flow to the place. Liver fibrosis is a scar tissue in the liver created when the liver tries to repair an injury. The scar tissue replaces the healthy liver tissues over time. The liver makes enzymes and bile that help digest food and gives your body energy. It also removes harmful material from your body, such as alcohol and other chemicals. Liver fibrosis does not cause signs and symptoms. Yeah. The fibrosis at the initial stage, you'll never find any symptoms or signs. And this particular case which I have is also a diagnosed case. It had not come to me and I did not send for the investigation. It was an already diagnosed case which had come to me, which I'll explain to you later. Liver fibrosis therefore does not cause signs and symptoms. You may have signs or symptoms of a condition causing the fibrosis, or if you develop cirrhosis over time. Whatever is causing the fibrosis, like alcohol addictions or drugs, etc., you might feel that you can see that there's an impact of that particular substance on the person. Like the person is losing his appetite, or he's getting side effects of certain medications, etc. Fibrosis in the mild to moderate stages often does not cause symptoms. Due to lack of symptoms, many people live with liver damage or fibrosis without being diagnosed until they have symptoms of cirrhosis. Unfortunately, today is a very sad day for us in our college. We lost one of our dear friend to cirrhosis, and he passed away today. So I feel, this is a very apt topic which we all should know. Fibrosis can be reversed if detected early enough, and the underlying liver disease that caused the development of fibrosis can be cured or treated. If fibrosis is left untreated, it can lead to cirrhosis or liver cancer. It is important to remember that the process of fibrosis progressing to cirrhosis happens over a long period of time. So, fibrosis, first the fatty liver, then the fibrosis, and then the cirrhosis. It's a very gradual process. It does not just happen, in a sudden way. The time it takes for fibrosis to progress is different for every disease and every person. Not everyone who develops fibrosis will progress to cirrhosis. Not everyone who gets cirrhosis will get cancer. So fibrosis will gradually go into cirrhosis, and it may or may not lead to cancer. And so mostly by the stage of cirrhosis, most of the people are detected. And if it is taken care of, at least most of them do not go into cancer. This is the stage. It's a healthy liver. It is a fibrous liver. This is a cirrhosed liver. And the last one is a cancerous stage of the liver. You can see that this is a healthy normal one, looks very red and clear. And here you can see that there are white patches, kind of more cirrhosis. It is more darker, and eventually the cancer stage. Patients may be born with a fibrous liver. There are cases in which children are born with a bit of fibrosis in the liver. And other causes for fibrosis are long-term alcohol use. People who consume alcohol, chronic alcoholics is what we are speaking about, for a very long time, can also get fibrosis. Certain viral infection that affects our liver, like hepatitis B and C, can also lead to fibrosis of the liver because it is damaging the liver. Certain medications like corticosteroids and certain medications which are used to treat tuberculosis can also lead to fibrosis of the liver. Certain metabolic disorders like hemochromatosis, too much of iron in your blood, or Wilson's disease can lead to, in certain conditions, not that everybody will not get it, certain times it can even lead to fibrosis. Non-alcoholic related fatty liver disease. This is very common nowadays. NAFLD is what it is written as, non-alcoholic fatty liver disease. That is also another cause for fibrosis. Blood flow problems into or out of your liver, like as from Budd-Chiari syndrome, heart failures, or portal vein thrombosis. And autoimmune disease that affects your liver, like autoimmune hepatitis or primary biliary cirrhosis. Okay, this is the important part. Fibrosis, I think everybody knows. We will look at the investigation part. Okay. So there are few blood tests that can be done. I'll be explaining about the blood test again later. And ultrasonography, MRI, CT scan to check whether check your liver, spleen, portal vein. These tests cannot see scar tissues in a liver, but they'll be able to see other problems related to this. How well they are functioning, etc. It can be found out. Elastography is the test that uses ultrasound waves or MRI to find if your liver tissue is stiff. This is a fibroscan we'll be speaking about later. This may help your healthcare provider know if you have advanced liver fibrosis or cirrhosis. Last one is a liver biopsy. Earlier, it used to be like liver biopsies. Now we have advanced, investigations, fibroscan and all this stuff. So biopsy is not done much until it is going into a cancer stage or further investigation is needed. A liver biopsy may be done to confirm the liver fibrosis or find out how severe it has become. A biopsy is a procedure used to take a sample of the liver tissue to be tested. So this is the healthy liver, stage 1, beginning of liver damage. Stage 2, moderate liver damage. Stage 3, significant liver damage. And stage 4, severe liver damage. This is the fibroscan results. We'll be speaking about it further. You'll understand. Test for liver fibrosis. One is liver biopsy. A small tissue sample is taken with a needle and sample is examined under a microscope by a pathologist. Advantages, it's a gold standard, helpful in deciding between two differential diagnoses. Invasive, what are the disadvantages? It is an invasive procedure. Sample may not represent the entire liver. See, biopsy is only taken out of a small portion. Biopsy cannot be taken from the whole liver. So this is a disadvantage that we cannot understand if it is like the cancer has started in one particular portion and we are not able to reach that. You're taking a biopsy piece from a different area. So that we might not come to a proper diagnosis. Sample cannot be interpreted or staged differently. Imaging tests, we'll study further about these. Fibroscan or transient elastography measures liver stiffness. Others are ultrasonography, ultrasound, CT or MRI scan. These are non-invasive. They are more accurate. They are highly accurate and the results are very rapid. Equipment not always available. So what are the disadvantages? This is a very expensive equipment. It might not be easily available. Reduced accuracy in people who are obese because of fat issues, obesity. Most of these fibrosis, liver fibrosis, etc., will be seen in people who have a sedentary lifestyle, less of exercises, etc. So obesity is something which we have seen majority of the cases with liver fibrosis. Other conditions may cause liver stiffness. Okay. So it need not always be fibrosis. It can be some other conditions also. Blood tests. Some of the tests include F1B4. This is ALT-AST ratio, prothrombin. It is like a test which is done to diagnose liver fibrosis. APRI. I'll be explaining again. Enter routine lab values into a calculator tool. What are the advantages? It is convenient, low cost, can determine if someone has cirrhosis. Disadvantage, most advanced blood tests only effective in people with HCV. Cannot determine specific fibrosis stage. Can over or underestimate fibrosis. So until recently, liver biopsy was the only way doctors could determine the stage and degree of liver damage. Now there are both blood tests. The blood test is FIB score is less than 1.3 to 1.5. That is a normal liver. If it is above that, that shows that they have fibrosis. APRI score less than, that is AST prothrombin. It's a ratio it is. So if it is less than 0.5 and the imaging test that can determine the liver damage. How can you understand your liver elastography or fibroscan results? Here there are two. In fibroscan, you have two things you have to look at. One is the fibrosis will be, you can understand the fibrosis level, and the other one is you can understand the fat deposit level, the CAP score. Okay. So fibroscan results are interpreted using two key measurements. One is liver stiffness, that is a fibrosis, and a controlled attenuation parameter, CAP score. So whenever you do the fibroscan, you will get both the results. There is one example which we can see later. The liver stiffness measurement expressed in kilopascals, kPa, indicates the degree of liver fibrosis or scarring. CAP score measured in decibels per meter, dB per meter, assesses the amount of fat buildup in the liver. So normal liver stiffness is generally below 7 kPa, kilopascals, while higher values suggest varying degrees of fibrosis, potentially progressing to cirrhosis. So the liver normal, if you do a fibroscan, it comes below 7 kPa. That means your liver does not have fibrosis. And as the number increases, you have F0, F1, F2, F3, F4 levels is there. So we'll further study it later. And the CAP score can also help identify and categorize steatosis or the fatty liver disease. So liver stiffness measurement we will look at. It is LSM reported in kilopascals, already mentioned. Reflects how stiff the liver tissue is. If it is a soft liver, that is a healthy liver or little or no fibrosis. Stiff liver, that is a scarred liver, that is a fibrosis or cirrhosis. Stiff liver in the sense there is lots of fibrous bands. So it is like soft liver will always be very palpable. It will be very smooth to touch. While a stiff liver will be very hard. It will be a little more harder in comparison to the soft liver. So F0 to F1 stage is mild, no, F0 is absolutely no fibrosis. F1 is mild fibrosis. It is less than 7 kilopascal scale. F2 is moderate fibrosis, 7 to 9.5. F3 is advanced fibrosis, 9.5 to 12.5. And by the time we reach F4, it is cirrhosis or severe scarring, more than 12.5 to 14 plus kPa. I hope you're able to follow. Should I decrease my speed or anything?
Yes, doctor, you can continue.
Okay. If you want me to explain something again, kindly let me know. I'll do the explanation again.
Sure, doctor.
Yeah. So second one is the CAP score. So here it is. Decibels per meter is how it is measured as. Controlled attenuation parameter, CAP, is a measurement provided along with the liver stiffness in fibroscan. So whenever you get a fibroscan, as I said, I'll show it to you later. One example is there, you will understand. You get both the scores. You get the CAP score also, you get the stiffness score also, right? So it estimates the degree of liver steatosis or the fat accumulation in the liver. It is measured in decibels per meter.
Doctor,
Yes,
can
doctor.
you please slow down a little?
Okay, sure. Well, I always have a problem of going very fast. So if I'm not too I'll reduce my speed. Okay. So controlled attenuation parameter or CAP is a measurement provided along with the liver stiffness in fibroscan. So fibroscan, as I said, you have two scores. One is the fibrous tissue, how stiff it is, stiffness score, and one is the fat score. Okay. It estimates the degree of liver steatosis or fat accumulation in the liver. How much of fat is accumulated in the liver? This will make you understand. It is measured in dBm or decibels per meter. CAP, the full form is controlled attenuation parameter. It measures the liver fat or steatosis. It does not tell you about the fibrosis. So you will certainly get a case sometimes with fibrosis will be 0, but your CAP score is very high. That means that your fatty liver is severe. Or you might get something like fatty liver is S1 or S2 level, but the fibrosis is way ahead. Okay. The machine checks how much the ultrasound signal is attenuated, weakened as it passes through the fatty liver tissue. So see, it's a sound signal which has to pass through layers of your organs. So if it is weakened or if it is little slow, that shows that there is lots of fat in your liver. Higher CAP, more fat in the liver. Now we will look at the readings. Less than 238 CAP score, S0, less than 5% of fat in the liver, meaning no or minimal fat. There is very little fat in your liver. 238 to 259 it's a S1's grade, and that is more than or equivalent to 5%. Mild fatty liver. Between 260 and 290, it is S2. More than 34% or equivalent of more than 34%, moderate fatty liver. And more than 290, if CAP score is more than 290, it is S3. More than 67% of your liver cells, there is fat accumulation. It is a severe fatty liver. Can I go to the next slide?
Yes, doctor.
Okay, so interpretation of the FibroScan. The FibroScan result is not a single number. So as I told you earlier, you get both the numbers, liver stiffness number as well as the CAP number. The measurements are used to assess both the degree of liver scarring and the amount of fat in the liver. Higher liver stiffness indicates more fibrosis. Higher CAP score indicates more fat in the liver. Doctors will consider the FibroScan results alongside other clinical information like medical history and other tests to determine the stage of liver disease. For example, a patient with liver stiffness of 15 kPa might be diagnosed with cirrhosis, while a patient with CAP score of 300 decibel per meter might have severe steatosis or fatty liver. The last one, I'm just skipping it. This is the first case. A 40-year-old male patient presenting with abdominal discomfort and bloatedness. Uric acid was high. Total bilirubin was 8. Ultrasonography showed fatty liver grade 1. ANA, anti-nuclear antibody, was positive with fibrosis scan F3. So that was showing an autoimmune problem due to, it could have been either because of severe stress or whatever. It was showing a very mild reading, ANA. So the history of this patient was, history of suicidal deaths in the family was there. I'll tell you why I told about this. See, this is a very big case taking. So I can't include the whole case taking into this. I've kept the gist of everything. And 2 or 3 medicines, etc. has been given. So I'll explain to you why that was given eventually. History of suicidal deaths in the family. This person is very sensitive. So he thinks of suicide occasionally, but I'll let you know why. He's an IT job, person. There's lots of work pressure. Nowadays, it's like, they have lots of pressure in the IT job, very insecure job. And there are cases in which they would say like, we went in the morning and when we were swiping or some of my colleagues were swiping, they came to know there is no accessibility into the job because they have been laid off. Okay. So that kind of insecurity will be there in IT jobs, and it is there in IT jobs. Will be there. No, it is still there in IT jobs nowadays. So he has a history of anxiety slightly during presentation, etc. This is all he has given me. Lots of responsibility of the whole family. So he comes from a village north of India, and he is the main earning member of the family. Rest of them, a few of them are into farming and all this stuff. He takes care of the father, mother, his own family, and his extended family also. It's a big joint family. So he's the first educated person out of the family. Now what happens is there is lots of responsibility, and even there are people who are, they are working, but sometimes they put loads of responsibility on his head. And initially he used to feel, he used to feel sad and, thinks even of suicide sometimes, but then he'll say, I have the responsibility of the whole family. So it was somewhere like a syphilitic remedy it was coming. Hot, desire, sweet. Hot was a ambithermal. He was telling, yeah, occasionally I feel hot, occasionally I feel, cold, more towards hot. Desire, sweets. He likes all the states, but he prefers sweets. Pain, aggravation lying on left side. Occasionally pain in the right side, and there's lots of flatulence. So this patient, he came to me with a fibrous scan. The scan report was 177 CAP. That is the fatty liver. So it was, grade 1 fatty liver. And the stiffness of the liver was 10.9. So we'll go back to the earliest slides. 10.9 stiffness is F3 or advanced fibrosis. It is about 9.5. It is advanced fibrosis. Okay. So I did the repertorization. The first medicine which came was aurum metallicum as the his constitutional medicine. Okay, at that stage, because of the syphilitic remedy is what I wanted to choose initially. So I took up aurum metallicum 1M. And Cardas Mute Q was given, but since it has alcohol, I asked him to dilute it much and then take. Thiocyanum 6C was given. Okay, I'll explain to you further why thiocyanum was given, how it helps in fibrosis. Second prescription was Hydrastis Q as a tonic. And the last prescription I have given him was Lycopodium 10M. Why again? Now the person who's taking so much of responsibility, he knows that many people are dependent on him even when it is not needed. So the normal emotion of that person should have been anger, irritation. I'm not going to take up anybody's responsibility, etc., etc. Or probably even if he's suppressing his anger, also he should get anger as a very healthy emotion. But here he was getting it as suicidal tendency. So eventually Lycopodium 10M was given. His uric acid also came down and most of his complaints came down. Thiocyanum 6C was continued. Okay. So this is the result later. After 4 months of 5 months of treatment, it showed 10.9. Okay. No, not 10.9, 5.7, sorry. This is a 5.7 reading. That is the after 4 months of, treatment. This is the second reading, 5.7. And the fatty liver is more or less the same, 173. Okay. 5.7 according to the reading is less than 7. So it is a F0 to F1 or mild fibrosis to no fibrosis case. Okay. So I'll explain to you why thiocyanum has been given. It's a classical remedy for dissolving scar tissue. We all know that thiocyanum is of choice for scar tissues. It helps in absorption of scar tissue, fibrous adhesions, strictures, and cicatrices, especially effective in post-surgical adhesions and uterine or cervical stenosis and corneal opacity. Okay. Second medicine which I have used is Cardas Mat. Great remedy for liver cirrhosis and fibrosis, enlarged congested hard liver, pain, aggravation lying on left side. There is even ascites. To that stage, it did not reach. Now, Hydrastis also was given as a chronic liver catarrh weakness. So other medicines which I give, Hydrastis sometimes I give as a liver tonic kind of. Okay. So this is the explanation for the remedies which I have given. And now the cases, second cases of a 24-year-old boy, very studious child. He's very quiet. He likes, to play guitar and all. Very studious child. He got in bits and all this stuff. He through and through, he's been a very studious child. So he came to me with this complaint. Okay. So it was earlier diagnosed as tinea vesicularis. And this is the discoloration on his back. Okay. So this is almost like more than 4+ years of the skin eruption. It keeps on spreading. And initially it was in the upper region, then later on down, and the tinea cruris also started on his genitals, etc. So his sibling also had similar complaint of tinea, which was, it got cured. Then after that, this boy also was taking medication. So initially I tried many medicines. So this was a near failure case it was, okay? So I tried Bacilnum. Then I have given him some, medicines like his constitutional medicine was Natrum Carb. I'd given that. Everything I tried under the sun. So one fine morning, what happened was, he studies in BITS, as I said. He had a party. He ate lots of fatty food. Okay. Fatty food, and he got aggravated. He sent me a picture like this. There were also hives or urticarial rashes kind of was there. Then another day, he took some antibiotics for some, some illness. He got some throat infection or something. Again, after some fatty food or some ice creams and all. And then again, he got the hives. So I thought probably we should look at the liver test. Okay. So his total bilirubin was 1.5, indirect bilirubin 1.14, triglycerides 183, vitamin B12 was 164. And he has urticarial eruptions associated with gastric complaints. Okay. So now recently is when we have started the new medicine. The medicine given was Astac. Okay. Astac flu. It is derived from, this is the now picture, a little more of the patch is remaining. He recently just went and had some alcohol, beer or something. After which he came and told me that it is slightly aggravating again. So slight eruptions, it was almost little less than that. Slightly it went up, but it remained here. It did not spread further. Now it is, I did not get the latest now. And Astac flu. Astac flu, it is derived from freshwater crayfish it is. Okay. Sphere of action, the skin, liver, spleen. Skin symptoms are most important. Urticaria. Liver, there is jaundice with itching of the skin. Urticaria, hives, nettle rash with intense itching. Eruptions connected with liver disorder. Itching, aggravation, night. Gastric disturbances with fullness of the abdomen, heaviness of abdomen, indigestion from rich food. Sorry, there's a spelling mistake, grammar. Weakness, there is prostration, tendency to glandular enlargement, aggression at night after rich food from overeating, amelioration by cold application. This is another thing which I have seen in the child. He comes and he says that he's better by cold application. So Astac 30 was prescribed. Okay. For this case, Astac 30 was prescribed. Now we will look at all the remedies in general. So I have already spoken about thiocyanum. Next is chelidonium. It is a right-sided remedy. It is a right-sided liver remedy. And there will be pain under the scapula. Scapula region, there will be a pain. So, Kali Carb also will get that pain. Yellow skin, jaundice. Constant desire for warm milk or tea. Okay. So chelidonium, most of the cases when children have gastric upsets, but they want to drink warm milk, I generally prescribe chelidonium for children. Their appetite increases. They don't want to eat food, but they want to drink warm milk or warm tea or whatever. So if this comes most of the times with the rest of it is matching, then I do give chelidonium sometimes. So then their appetite comes back. Okay. Second one is cardamom. We already spoke. It is one of the best remedy for liver cirrhosis and fibrosis. Enlarged, congested, hard liver. Painful liver, worse, lying on the left side. Ascites due to liver disease. Okay, there will be accumulation of fluid due to liver disease. So all this is in the cirrhosis stage. Later on, you will find all this. So at that time, mother tincture with alcohol, we should dilute it well and give. If at all you're giving mother tinctures, and try to give in the lowest potency if possible. If it is potencies, try to give it. If liver cirrhosis happens, generally I prefer not to give alcohol-based medication. So we give it in the trituration, 3x, etc. Then is phosphorus, fatty degeneration and fibrosis of liver, hemorrhagic tendencies. They can be bleeding, weakness, craving for cold drink or ice, anxiety, oversensitivity. So cold drink, they want cold drink, you can think of phosphorus. Hot, one of the thing which likes warm drinks, and this one, it is lycopodium is also there, and chelidonium. Lycopodium, liver fibrosis with digestive disturbances, flatulence, bloating after small food intake, crave sweets. Okay, this is very marked. I've seen many of my, even the female complaints, sometimes they will say, when they get angry, etc., they're not able to express. I've heard many of them say, we crave sweets. Then if it matches the lycopodium picture, I give lycopodium most of the times. But you can never start, generally, I never start a prescription with lycopodium. Probably if it is the most indicated, it might be effective, but I am a little scared to start with lycopodium, like the theory says. So I always ensure that I see what it is and then give. Naxomica for liver fibrosis due to alcohol abuse, drugs, and sedentary lifestyle. They are very irritated, they are very irritable, they are very oversensitive, they are dyspeptic. They have lots of gastric issues. They get irritated over trifles. If you ask a Naxomica patient again and again, did you eat food? Again, after some time, did you eat food? I told you already I ate food, and with a little more of anger. So they are very oversensitive also. Constipation with ineffectual urge. Merxol, enlarged hard fibrotic liver, tremors, night sweat, metallic taste, increased salivation, I did not write. Jaundice with offensive stools. Merxol will always have offensiveness in the stools. China officinalis. Again, like cardamure, this is used more often, China, for liver fibrosis with ascites, more going towards cirrhosis. Abdominal distension, flatulence, anemia, weakness after loss of vital fluid. Then we have Kali carp. It is given in advanced fibrosis case, cirrhosis case, there will be a pinpricking pain that will be in a particular one spot. Pain, stitching pain. So Kali carp, mentals is, that is a person who had good authority and suddenly somebody else comes into the authority position. So the mentals of Kali carp is very beautiful, So they lose authority and they start, they start developing symptoms. Stitching pain in the liver region. As I said, a particular pinpoint pain. Weak, chilly edematous. Sulfur, we all know sulfur. Constitutional support in chronic cases. Liver complaints with skin eruptions, heat, itching, crave sweets, spicy food. Other remedies for scar tissues. So we know all the remedies for fibrosis. I'm just telling this. Silesia, old hard indurated scar tissue, suppuration tendency around the scar. So wherever there is a scar tissue and in that scar, if a pus comes out, okay, then you can think of silesia. Scars that reopen and discharge pus, keloid adhesions that are hard, stony with burning. Graphitis, keloid, thick, hard, elevated scar, scar with itching, oozing, and cracking. I think we all know cracking of nipples, etc. Graphite is given. Useful for scars after burns. Acid floor, hypertrophic and painful scars. Patient feels better from cold applications. I'm not going into the mentals of acid flow. Causticum, contracted scars causing pain or deformity. Scars with pulling sensation affecting movement. Okay. Calcarea floor, hard, stony, indurated growth, scar tissue with extreme hardness, adhesions, fibrous nodules, useful in internal fibrotic conditions. Yeah. So wherever there is fibrosis inside, I could have even thought of calcarea floor, but fortunately for me, the potency which I have given for thiocyanum was 6C. Okay, but my mother always says that 3X is a better one. It is a little more expensive. It's a powder form. You make powder doses of it, and that seems to be working wonderfully, which I give for any kind of fibroids, etc. for women. I prefer a 3X potency. So calcarea floor, 6X potency or any potency of your choice. Phosphorus, adhesions after pneumonia, pleurisy or abdominal surgeries, scar tissues with bleeding tendency. So usually it is, bleeding with pneumonia, they might cough and they might be bleeding, etc. Think of phosphorus. Next is carbo animalis, old indurated scars with bluish discoloration. Carbo family, bluish discoloration, hard nodes or masses left after injury or inflammation. So other supportive organ remedy tissues is syphilinum. See, if there is alcohol, this person, the previous case was not a chronic alcoholic. He was a social drinker. So if it was syphilinum, self-destructive tendencies, the other person had thoughts of suicide, but he has never attempted it. Okay. So I think more of aurum metallicum stage. Syphilinum is when they give up, they are into self-destruction stage. And Feltaury is another medicine of choice for gastric complaints, where there is, that sleepiness after. Hydrasis, chronic liver catarrh weakness. General advice and fibrosis of liver. Last time also during the Malayan section, I had told this very clearly. We should avoid alcohol completely. Okay. If there is only fatty liver and not much of fibrosis, you can ask them to take lots of fiber into their diet. Okay. But if there is fibrosis is setting in, okay, the liver is already in the process. It is struggling to keep up with the, to regenerate or to heal itself. Now, what we are not going to give very heavy fiber food, and that will be an overload for the liver. So we should give the liver easily soluble fibers, probably blanched vegetables, sauteed vegetables, or anything in a easily digestible fiber form. Avoid hepatotoxic drugs, regular monitoring of LFT, ultrasound, and fibroscan. This is all. Thank you.
Thank you, Dr. Asha.
Pleasure.
The session was really very interesting, and you explained everything very clearly with the patient. Doctors, if you're having any doubts or if you're having anything to share, you can share now.
There is a comment from my mother's end to slow down a bit.
Doctor,
Shweta
there
is the moderator.
There is a question in the chat box. Dr. Rekha is asking about Sionanthes. Do you have any
Rekha?
experience with the Sionanthes like that? She's Dr. Rekha is
Sionanthes is also a very good medication for this one. But for me, right now, in this case, Cardas was more indicated. So therefore, I gave it. Sionanthes, all these are medications which can be used for, all the liver, spleen, so it covers up both. But here in this case, Cardasmar was more indicated because of the left-sided, discomfort. Dr. Rekha Srinivasan, is it? A good friend of mine.
Well, it is often happens. The doctor, after preparing a long time and presenting, everybody is listening, but nobody is responding. That is often happens. What is the meaning of that? I don't think what is the meaning. I don't know. Anyway, your presentation is always nice, as there is
Thank you, sir.
lot of potential. Especially we know you are the daughter of Dr. Ramade, definitely we are proud of her. And what
Yeah,
about the percentage of this fatty liver fibrosis, the prevalence of this condition in all over the world as well as in Kerala and India?
yeah, it is, very highly prevalent nowadays, especially the fatty liver is very prevailing. I should say more than 60-70% of people are, under this one because of a sedentary lifestyle, no, sir. We're sitting in one, position. We're not moving around quite a lot. Yoga and exercises do help. So I do advise people to do yoga, etc. And also go for walks and cut down on the fat food and packed food, etc. So it's a holistic approach always. So, the whole thing.
But I
It's
think
a
other
lifestyle
is
disease.
because a lot of young persons in the recent days, they are doing regular exercises after listening their physician's advice. But what happens is that even sports stars, they're also succumb to these fatal diseases in younger age. So there is some disparity, some problem on the assumption or this assessment made by this physician in this case, I think. What's your opinion? Yes, that is by
Yes.
Dr. Varghese, right? It's a miasm. We know the aforementioned footnote 206. These are too insignificant to cause a chronic disease, continue for years, and develop year by year. Dr. Seda, do you remember that?
So in this, ANA was positive. So it was an autoimmune. It could have been a viral attack also. So anyway, since it is went on in 4 months, we can't rule out, we can't, of course, viral has to be taken into consideration. Though it was not diagnosed as anything viral, it could be a probability.
So as homeopathy physician, we should have our own views on that. So it's always better to think according to homeopathy philosophy, because it is quite evident that, that's why I already said, even though after taking this regular exercises and all other things, the heart diseases, these liver diseases are always increasing.
Because of
How,
stress.
how can you account all these things? If you read through this way, we can't do that. Moreover, who did really change the lifestyles of the nowadays? These physicians, they're always talking about this nutrition pattern. You should take protein, you should take meat, this or that. So many advice are given, all in vain. I think Dr. Varghese can add more than that. He's an experienced person. Sir, please unmute, sir.
And by the way, everybody,
Thank
happy
you,
Ganesh
Manoj
Chaturthi,
ji.
sir. आपको भी happy Ganesh Chaturthi, आपको भी.
आपको thank you all to thank you, Dr. Manoj ji, and हमारे बुजुर्ग Dr. Rama Devi Ambani advise is slow down. So very well. Thanks, Dr. Asha Varghese. Nice presentation.
Thank you, sir.
Excellent session. Liver trouble, liver complaint. Liver is second brain. Liver is a second brain. So liver is a type of, there are 3 angle treatment: symptomological angle, miasmatical angle, and pathological angle. So a stage by a stage, liver first stage cirrhosis, या liver fatty and liver fibrosis stage. So miasmatical angle is a very good result. And lifestyle, exercise, etc. Diet is a very essential. Liver problem, diet is a very essential. So nice presentation. Very, very thanks, Dr. Varghese.
Thank you,
Thanks,
sir.
Bani.
Ambadi.
Party.
Ambani.
Yes, sir. वो क्या says the thing is like even if it is like the liver, no, like you said, it is very important because people they eat food and if you don't eat it with a peaceful mind, no, that food they say gets converted into poison, not into amrita. They say, right? It's like that. So, yes. So you know the food we eat, we should eat with peace, which is not happening nowadays. I feel we eat in a hurry. We eat it in like you know the same. When we are on a holiday, we are happier. We seldom get gastric upsets. Like if you eat healthy. Wahi, if you sit at home, you are eating sometimes a normal food, still you can feel, you know, sick. So it is also the mindset when you're eating your food that is very important, I feel. You know, as you said, that is the second most important or one of the most important organs in our body. If your liver is good, they say your whole health is good.
Okay. Thank you.
Thank you, sir. Thank you, sir.
I think her mother is very eager to say something on her doctor's presentation. Dr. Amadayambadi, madam, please.
Just nice presentation. I had told her not to go fast. Otherwise, she has to wait for questioning. Nobody is responding, no. That's why I told her to slow down. Then it is and about it is attack of the liver and heart disease, no. Stress, one cause nowadays, more stress, improper food as well as sleep. Their sleep pattern is very wrong. Then see pesticides. They are using for cultivation. They are using all pesticides, and it also affects the liver. I think so.
No, no, it's
Isn't it?
a very important
You
point.
know. Anyhow, nice presentation. Keep it up. Come again.
Thank you, ma.
Come again with some other points, but
Yes.
go slow down.
Yeah. I think
Go
I'm so
slowly.
used to.
Don't follow your mother.
See, that's in the genes.
Dr. Asha,
Thank you. Thank you.
Yes,
Thank
ma'am.
you, Manoj.
Dr. Asha, very nice class.
Thank you so much.
Some more medicines also
told.
says in today's class. But in Malayalam,
I did not include Astak because I thought I'll only cover up fibrosis. So that day, what
only.
happened was, yeah. So that day, I think the slides got over a little faster. So I told sir, Danesh sir, that I'll add one more case so that the slide, but still I felt I went too fast in spite of the extra slides. So
Okay.
Astak is a very good medicine. Myrica, Astak and all, I use quite a lot in certain cases. So Myrica is also a nice one. Myrica, I have not written over there. Myrica is also a very good medication for liver. So that I have not written. In fact, I should have written that too. So anyway, I got an opportunity to tell this. Yeah, for urticaria, generally Astak I gave. And yes, and I hope I have not left any more medicines.
Today's class, your mother is
Papaya,
anxiously hearing.
kakaiha papaya, papita is very good.
Yes, sir. Karika papaya is also, yeah.
Very good. Yeah.
Spleen and liver ke liye.
Your mother anxiously hearing your class. In between biting the nail also. Tension.
Oh, is it? She's anxious.
Okay, thank you.
My blessing is,
My mother.
Yeah.
yes.
At that time when I saw it was only 9 o'clock. I know it is almost finished. That's why I worried.
No. I would have
Okay.
dragged on like, then I went a little slow. Sometimes I go with the flow and I go too fast.
Yeah.
Okay.
Anyway, don't forget to attend our 5th year celebration.
I've already booked,
28th
sir.
of
I'll
this
be there.
month.
I'll be there without fail. I'll be there. I already told my mother. I'll be there without fail.
Yes, thank you. And
Thank
kindly
you, sir. Thank you.
register. There are 27 persons in this platform as of now. So I hope all of you will be joining our program, ambitious program.
Yeah, this is a golden opportunity for us to meet you
Ram
all, sir,
sir,
stalwarts.
Ram Parvesh sir, please come. We can meet. We can meet, no?
ശല്യപ്പെടുത്തരുതെന്നാണോ? Don't
Please try
disturb
to
me
come.
എന്നാണോ? Don't disturb me എന്നാണോ?
Thank you.
No, no. Thank you. Thank you.
Congratulations, congratulations, Dr. Asha. Congratulations.
Thank you, sir.
Behalf of ISCH whole team, very, very thanks. Dr. Asha Varghese is a dynamic personality.
Thank you, sir. Thank you, sir.
Always learning tendency. And mummy is a very good person.
Thank you.
Thank you.
Thank you, Ram Parvesh.
So we are all looking forward to seeing you also, sir.
What
Please
happened
try
to
to come,
Dr.
Ramparvesh.
Shweta? What happened to Dr.
Please
Shweta?
try to
Shweta
come.
is the moderator.
Yes, Doctor. I'm here.
Okay, okay. Wind up the section.
Yeah.
It's 9.
Okay. It's
28.
time we can conclude the session. And before concluding the
My
session, there is
IT.
an announcement.
Ayush Mantralay join RO. My daughter, Dr. Priyanka Bharti.
Okay. Continue, Dr. Shweta.
Okay, before concluding the session, there is an announcement. We are happy to announce that uninterrupted daily webinar session of IFPH has reached its 5th year anniversary celebration. And IFPH was formed during COVID-19 by a team of homeopathic doctors and well-wishers to promote and spread homeopathy to the nook and corner of the world. Since then, we had conducted uninterrupted daily webinar sessions. We need to celebrate it together. IFPH 5th year anniversary celebration is going to held on 28 September at Hotel Taj Vivanda, Cochin, Kerala. We invite you all to join the celebration and make it a grand success and memorable event. Please register to take part in celebration. For registration, you can contact Dr. Saji Varghese. Contact number is 9207 43395. Thank you all. Thank you, doctors. And I'm handing over the session next moderator.
Shweta, you are also invited.
Thank
Did
you,
you-
ma'am.
You
Thank
will
you.
come.
Did you register?
Hope you will come.
Okay.